Emmy has found that there isn't a single bed anywhere in England set aside specifically for the treatment of the disease.
Also known as chronic fatigue syndrome, ME is a long-term condition that can cause debilitating symptoms like brain fog, muscle pain and extreme exhaustion.
A special hearing to discuss the results came after the inquest into the death of 27-year-old Maeve Boothby O'Neill, who died from malnutrition and dehydration. She'd been living with ME for over a decade. Our correspondent, Sophie Long, has this report.
Maeve was a healthy little girl who became an articulate and talented teenager with a bright future ahead. But as a young woman, she developed chronic fatigue syndrome, or ME, for which there is no cure or singular treatment. Maeve's condition deteriorated to the point where she couldn't eat, drink or sit up. In October of 2021, after suffering from the disease for nearly a decade, Maeve died of dehydration and malnutrition. She was 27 years old. 3 years after her death, an inquest reviewed 6,500 pages of evidence. The 2-week hearing was a gruelling and heartbreaking process for her mum, Sarah, who told the court her daughter's death was both premature and wholly preventable. A representative at the Royal Devon and Exeter Hospital, where Maeve was admitted 3 times during the last year of her life, denied that was the case and said they had not failed in their duty of care. In August, the assistant coroner delivered her findings. Deborah Archer found that Maeve died of natural causes because of severe ME. She said a named healthcare professional should have been appointed to coordinate her care and that a feeding tube may have been fitted earlier. But she said ME is a disease with no cure and the outcome may have been the same, whatever the treatment given. She also ruled that Maeve's death could not be attributed to neglect on the part of healthcare providers. Maeve's parents continue to raise awareness of ME, the lack of knowledge and training in how to treat the condition, and the woeful lack of research. The government has said it is committed to improving the care and support for all those affected. Sophie Long, BBC News.
Well, we're joined by respiratory specialist Dr. Binita Kane and Maeve's mum, Sarah Boothby, who join us now. Thank you so much for coming in and sharing your story. For you, Sarah, it can't get any easier.
No, I'm really thankful to both of you for inviting me on today, because I would like it to get a lot easier for everybody who is going through what I went through and what Maeve went through. It's a long time ago for us, for me, and nothing's changed since then, so I feel really frustrated by that. The need for change is not less, it's greater because of all the people who've had COVID and have developed ME from COVID.
I was going to say, it's a big fallout from long COVID, isn't it, ME, and more cases of it. So do you think the dial hasn't shifted at all in terms of the medical conversation around it?
Well, it hasn't, and in a way, at the moment, it can't, because there's no pathway in the NHS. That's what the inquest found. And we knew that already, and so it's really frustrating for a lot of people, and I'm one of them, that we know what is needed and we know it's not there, but trying to communicate, who do we communicate that to? You know, who's going to listen and how do they get to hear us? Because the people who are the most severely affected are too poorly to speak for themselves, so they rely on their families, and then the families are treated as if they're kind of, ooh, hang on, what are you talking about? We don't know anything about this. And then they go and look it up and they go, oh, CFS, chronic fatigue syndrome, that's psychiatric. Oh, OK, we need a referral to psychiatry, but it's not psychiatric. ME is definitely not psychiatric. And I think, I'd be really keen to hear what you think about this, but I think that's because she didn't have any mental health needs. So they see this young girl who's perfectly fit and healthy, doing really well at school, there's no biomarker, and, well, there's nothing really wrong then. And there's something really wrong. She knows it, and I know it as her mum, but would you agree with that? That they say, you know, the no biomarker thing, it's like what you're supposed to do if you're a doctor.
Absolutely. So ME is a condition which we know quite a lot about now, particularly because we've seen the rates go up so much post-COVID, and it's caused by a very severe problem with oxygen delivery to the tissues. And so if the cells can't get oxygen, they can't produce energy, so it's a very energy limiting condition, but it also affects the autonomic nervous system. So that's a bit of the nervous system that controls all of our automatic functions like breathing, heart rate, blood pressure, digestion. So when these things fail, it can affect every organ in the body. And at the very severe end of the spectrum, you have patients who are bedbound, who cannot tolerate an upright position, who cannot speak, cannot swallow, who therefore are at risk of malnutrition and starving to death. That's like what happened
we have
to
an
Maeve.
extraordinary situation where it feels like the scale of the problems caused by ME are so great that the NHS and health services struggle to cope. You think it should be the other way around, where because they're so devastating, you'd think it would get more attention. I'm just looking at this statement from NHS England. You'll be very familiar with this. They are saying improvements are needed within the health service to make sure that patients and their families are listened to and receive the care they need in line with NICE guidance. We will work closely with government, patients and clinicians to achieve those ambitions. Now, that sounds like they're on message. What does that mean in practice?
The difficulty that they have, excuse me, is, I was smiling through everything that you were saying because we knew that, but how do we communicate that to doctors when we're not medically qualified? There's this very poorly person, really seriously ill, unable to eat, is very seriously ill, unable to move, and only just able to speak. When you see somebody at that level of severity and you've got no training behind you, you've got no education in it, it's just, I should be crying, and I do cry, and I might cry, but listening to you say that made me smile because it's relief. It's relief because I know how many other people are going through right now what I went through, trying to explain to doctors, trying to explain to social workers, and not being listened to and being treated as if somehow you're the problem.
Do you know, I think a lot of people listening to you speak, number one, will be very affected by what you're saying, but I also think a lot of people, me included, are on a big learning curve about ME. And I'm just looking at, and I hope this doesn't upset you. It's in some of the notes we were given. I know you know this. Go for it. 3 months before Maeve died, she wrote to her GP. She wrote to her GP saying, "Please help me get enough food to live. I'm hungry. I want to eat." So that was talking to her own GP.
And her GP was absolutely outstanding. She did everything she could. And the inquest heard all of that. And there was no help for her. GPs can't manage such complex patients on their own in the community. They need a consultant in the hospital. And the medical director who gave his evidence yesterday, he was also absolutely outstanding in finding out everything that we already knew. Of course, it was too late for Maeve, but it's not too late for everyone else. And so everything that he's discovered, combined with what Binita knows, will absolutely help them fill that gap because the knowledge is missing at the most severe end. Does that make sense?
It does make sense. And Binita, you outlined the pathology of it really clearly, which I've not heard in such a succinct way. Is it the case, do you think, that a lot of medical practitioners are just catching up? It's an absence of knowledge and education in that area.
So I think the medical profession have got this wrong for a very, very long time, for decades. And that's partly because in the 1970s, so before the 1970s, actually, post-infectious illnesses were taken quite seriously. And then in the 70s, for some reason, there was this kind of psychiatric label given to the condition, which has kind of permeated through medicine and stuck. So I was taught nothing about ME. I've been a doctor since the year 2000, and I was taught nothing. And I've learned most of what I've learned over the last 5 years. But there are, there's very few specialists out there. We're not taught. The decades of biomedical research have been ignored, and the patient voice has been silenced, and the patients haven't been listened to. And I think if they had, we might not be talking about the tragic death of a young person, and that has to change, and I think it's changing.
Do you feel like there is still some scepticism out there, though, about how debilitating this illness is?
It's a perfect storm of all of those things I've just said, and I think things are changing because the COVID pandemic has caused a massive increase in the numbers. Not a number of healthcare professionals have now been affected. And a few weeks ago on World Patient Safety Day, I wrote to the Secretary of State, supported by 280 other healthcare professionals, over 50 consultants, over 70 GPs, calling for urgent action to keep patients like Maeve safe, because at the moment there are no mechanisms in place to keep them safe from this condition.
Can I butt in there? Because I just want to build on that. Thank you so much. If Maeve had been diagnosed earlier, she wouldn't have died. I'm so confident of that, in the same way that if she had been given the tube she asked for in March, because she knew that was the only way that she was going to stay alive.
She wanted to live.
She wanted to live, passionately wanted to live. She was so that she hated dying. She knew she was dying and she hated it. I mean, that's awful. It's terrible for me as a parent because she needed palliative care and even that was denied her. And I don't mean palliative care in terms of pain relief. I mean somebody to talk to other than her mum about the fact that she was dying, because she couldn't talk to me. I was going to be upset. I couldn't talk to her because she was going to be upset. Who else did we have? Nobody else. That's just ridiculous. And she didn't have to get that poorly in the first place. If she'd been picked up earlier because she wasn't in need of any kind of psychiatric treatment, it was just like, well, this, we don't know what's wrong. And I don't think, just to come back to your question about is there scepticism, what I saw time after time after time with everyone who met Maeve, and there were a lot of people in the end because she had 3 admissions, was they were just bewildered.
Right.
They just didn't know what they were seeing. Right. They'd never seen anything like it. And I was feeling, and of course they were in a professional position, so they were doing their very best, and they were doing their best, but they did not know what ME was. So when I hear Binita describe it, it's just like, that's what they needed to hear. Maeve would have been able to do that, but she could hardly speak, and I couldn't do it. I'm not a biologist, I'm not a medic, I'm just a mum who also happens to be a social worker. So I understand how hard it is for professionals, but they need to put the patient there, because that's the person who knows.
Sarah, thank you so much. Binita, thank you. That's a big sigh. I really appreciate as well your family sharing the story. I know, you know, you've shared pictures of Maeve with us this morning, and the audience has seen those too, and it makes such a difference because it will draw people's attention more. But by personalising it, it's a brave thing that you've done as well, and you speak so eloquently.
The sigh is because it's so hard to get it through, and I really hope I'm being heard. Thank you so much.
You did brilliantly, honestly.
Thank you.
You really did. Thank you both.
Let's see, the time now is 8.